with Dr. Azadeh Fariba, specialist in all things women's health, including perimenopause, menopause, fertility, right? You do all of that?
All the things.
Oh my God, I know, you're like a women's health guru, which I absolutely love to have around because I only know this much about women's health. What we're going to be talking about in this interview series has to do with perimenopause because it is something that you find extreme interest in and also something I think everyone cares about now, especially on the internet where everyone's like, oh my God, let's talk about perimenopause. So what I want you to do is we're going to do like a little series. We'll talk about the different forms of things that you look for with perimenopause, how to talk to a doctor, the labs that we're going to be ordering, and then some things that we can do to implement in terms of when we implement treatment, how we implement treatment, and then kind of going from there.
Sounds good.
All right. Okay. So why don't you go ahead and tell us, like, ultimately, what age do people start noticing symptoms that might be indicative of perimenopause?
Okay. So you'll probably hear me say this a lot, but there's going to be a lot of variety because
always variety.
Everyone's different.
Yeah.
But I'd say, like, if we were going to capture an age range, it would be mid-30s to mid-40s.
Which I think is wild because, like, a lot of times people don't like think in their mid-30s that they're going to start having symptoms that might indicate going into menopause.
Totally.
Yeah.
And it's different. It's changing, right? Girls are getting their periods younger, and we can like talk about that in detail. But and so shifts are happening earlier.
So if someone gets their period earlier, are they more likely to start having perimenopausal symptoms earlier?
Yeah.
All right, so that's something good to take into consideration because it's happening way earlier now.
Yeah, 10, 11.
Yeah. All right, and then what, like, so it's a pretty wide range, right? So we've got like early 30s to what?
Mid-40s.
Mid-40s?
I'd say sometimes later 40s. It kind of depends on how in tune the person is with their body because some people just don't really pay attention.
Yeah, that's fair.
But yeah.
Yeah. Well, I think also too we aren't really taught how to pay attention.
You're not.
It's like what is a symptom, what's not, or like
Totally.
what is is this something we need to pay attention to? Do we not need to pay attention to it? But we're going to talk about those things.
Yeah.
Okay. So what are some of the really early or subtle signs that might get ignored in the beginning that might indicate someone's going into perimenopause?
So everyone thinks like hot sweats, night sweats, hot flashes, but that actually can come later.
Is that so? That's not an early sign we usually
Not
see.
always. I feel like that is like the one where people are like, well, I don't have this, so it's not perimenopause.
Yeah, that makes sense.
But I see a lot of mood changes. I'd say that's probably the most missed. Mood changes and insomnia.
Insomnia. Yeah. Okay. So what kind of mood changes do you normally see?
Anxiety.
Anxiety.
A lot of
because we don't have anxiety right now.
I know. There's so much to be anxious about.
We're so relaxed all the time.
Yeah. Especially in the week or 2 weeks before your period.
Okay.
So luteal phase anxiety can be a lot worse.
So maybe like those symptoms you normally would see during the PMS time are exaggerated.
Exaggerated, longer, more profound.
Great. Okay. So anxiety, any other mood changes people can have?
Low mood. There's one where I feel like a lot of people come to me and they're like, I just don't feel like myself.
Oh, that's a good one.
I can't explain it, but it's like I'm not me.
Yeah, that's a really good one. Or what about their relationship to other people? Do they notice changes in how they're like responding to the people in their life?
Yeah, a lot of being checked out. It often gets. They often get told it's burnout or depression or, you're just an overworked mom or, which
we all.
is true, but like, why do we think we should feel this crappy when there's something else going on?
Yeah.
But yeah, I feel like family members often notice irritability. And so patients will be like, well, I don't feel irritable, but if you ask my partner, they would tell you that I'm irritable.
Yeah. So that other people might notice irritability or maybe like a short fuse
with kiddos and stuff, just kind of snapping.
Yeah, like they used to have more patience. Now they really have like way less patience with something.
Yeah.
Yeah, that makes a lot of sense. And so that can be more like a more subtle sign that something happening. But I really like what you described in terms of like just not feeling like yourself or not being able to respond the same ways that you sort of used to.
Yeah.
So if hot flashes and night sweats are kind of the stereotypical thing we think of as like starting into perimenopause, and that doesn't happen till much later, we're looking for mood changes. You said insomnia.
Insomnia is a big one, or sleep disturbance. So either trouble initiating sleep, or some people will have trouble maintaining sleep.
Okay.
Waking up between like 2 and 4.
That's, yeah.
Which is, I mean, I know your Chinese medicine background says some stuff about our liver,
Might
right?
be some liver issues, yeah.
Which in perimenopause, our poor liver is working through big surges of hormones.
It is.
So it all makes sense.
It does, yeah.
Yeah.
So like difficulty getting to sleep, maybe waking up.
Waking up.
Like early or kind of at weird times of the early morning.
And then oftentimes people wake up and just start monkey mind. What do I have to do for tomorrow? Just like a lack of peacefulness.
Yeah, maybe that combines with some of that anxiety they were already feeling.
Yeah.
Yeah, and that makes sense because I think, you know, the fluctuations in estrogen and maybe some drops in progesterone.
And the ratios too.
And the ratios,
yeah.
which are I think are always important, but
yeah.
All right, so what types of hormonal shifts do you feel like in particular make those big changes happen?
So oftentimes in the beginning we'll see lower rise of progesterone in the luteal phase.
Okay.
Because people are either not ovulating every month, or they're ovulating early or late, or it's not a strong ovulation. And so normally progesterone rises, and that's where we get the balance of estrogen and progesterone. But now we have that high estrogen in the second half without the progesterone, and that really leads to the anxiety, the mood swings, the insomnia, irritability.
Yeah, so you get kind of like ragey without that kind of calm
exactly.
feeling of the progesterone. Yeah, that makes a lot of sense. And it can fluctuate, right? Like you can sometimes have one period that feels fine, or one cycle that feels fine, and then one that's just like totally chaotic and crazy.
As if it wasn't hard enough to diagnose. It's like, yeah, you can have like 2 or 3 good ones, and then one that's just...
It would be so easy if we could just be like, oh yeah, every month, like clockwork, I get moody at this time.
Yeah.
It's just like not like that.
Well, there's so many things that affect it. Your stress that month, how you're eating, how you're moving, alcohol intake, caffeine intake, all the things.
Yeah, so it's constantly changing.
Constantly changing.
And everyone's estrogen surges at like random and different times, which makes it really complicated to sort of figure out.
Yeah.
Yeah, that makes a lot of sense. All right, how do you distinguish perimenopausal symptoms from like other things that might be going on? Because like you said, we're stressed all the time. So how do we know that this increase of anxiety is maybe related to our hormones versus like all the shit that's going on in the world right now?
Yeah, good question.
Yeah.
I mean, there's multiple ways. Labs are always good, but that being said, they fluctuate. Even in one day, your labs can go up and down.
Yeah.
So
I wish we talked about this more. Actually, we will talk about this more. We'll make a whole nother video just about how the labs are constantly fluctuating.
they are wild.
Yeah.
And then there's some labs that are better than others. There's urine labs that can look at things a little bit deeper than serum labs. But again, it depends on the cycle. It depends on the day. Even though we do timed labs, but you can still miss things by an hour or 2.
Yeah.
So I feel like you just have to take a really good history and like time things out and look at and see if the mood changes are cyclical. And then what else comes with them? Like, are you having other symptoms of perimenopause or hormone stuff? And then you just treat.
Yeah. So maybe like starting to track the symptoms that you're having to say,
Yes.
okay, well, these are happening at these certain times, or maybe they seem like they're mostly at these times, but maybe not always.
Yeah.
Or when I get these symptoms, I also get these symptoms.
I think every single one of my patients I have them tracking their cycles, and then like putting not just their like bleeding in the app, but what's going on that day.
I love cycle tracking too, although I know a lot of people have distrust with like using the apps and stuff nowadays.
Yes.
But I mean, good old fashioned piece of paper and a pencil.
Yeah. I even have some patients who like do the little ovulation tests and tape them on and make it all pretty.
Oh, that's cool.
I may be one of them.
Oh my gosh.
It's fun.
So what we need to do is like get like some Etsy thing where people can like put stickers on a chart or something. All right. So what are some of the other more physical symptoms people might notice apart from mood changes or like insomnia?
Weight gain.
Weight gain, great.
It's a big one,
That's...
especially in the midsection.
Mm-hmm.
And usually it's like weight gain, but I didn't change anything.
Yeah.
Like, I'm eating the same, I'm moving the same, my stress hasn't changed, but I can't lose this weight.
Yeah.
Joint pain.
Joint pain.
Joint stiffness.
Stiffness. Which autoimmune diseases flare often in perimenopause and menopause.
Yes. People will struggle with histamine issues, especially around ovulation.
Mm-hmm.
And so, like, allergies or, like, period flu, cyclical, like, itchy eyes, watery nose, all the histamine stuff will flare.
Okay.
We talked about joint pain, tachycardia, like really fast heartbeat. That is a big one. I've had multiple patients go to the ER because they thought they were having a heart attack.
I mean, that makes sense. And also, too, with the anxiety piece, right?
Yeah.
You start having a panic attack or, like, your heart rate starts increasing really fast because if your estrogen's surging, it's like...
And then dropping.
Yeah.
Yeah.
Okay. All right. Well, that's helpful. So then we'll, and then we're going to go into more detail about what to do if you're having these symptoms and how to talk to your doctor about it. And then also, like, looking into different types of labs that we can do in the, it's not that great, but we use
it. Not that great, but a little roadmap.
True. Yeah. All right. We'll get to those soon. So, yeah, I'm excited.